What if the real trigger and root cause for your autoimmune disease, such as rheumatoid arthritis, your Hashimoto's, your multiple sclerosis, your lupus, was not in your joints, not in your thyroids, not in your nervous system, not in your immune system, but sitting right here in your mouth? What if the bacteria living inside of your mouth were quietly poisoning your immune system day after day for many years before you ever got a diagnosis? I'm Dr. Maryam Horiyat, a holistic, biological, cosmetic and implant dentist at Dental in Orange County of California. I have spent 20 years at the intersections of oral health and systemic medicine, and today I'm going to walk you through what the latest peer-reviewed science says about the jaw-dropping connection between specific oral bacteria, the toxins they produce, and how they can literally hijack and destroy your immune system. This is not a video about brushing and flossing. This is about why your holistic dentist may be the most important healthcare provider to visit this year if you're suffering from an autoimmune condition. Let me start with a fact most people don't think of. Your mouth is the only place in your body where part of your bone structures, your teeth, pierce directly through your soft tissue. Therefore, your teeth are the only part of your skeleton that is exposed to outside of your body. That means every single one of your teeth is a potentially entry point for microbiomes, especially bacteria, to access your bloodstream and lymphatic system. This wouldn't be a problem if your gum were perfectly healthy. But here's the reality. More than 75% of American adults have gingivitis or gum inflammation, and more than 50% have some form of irreversible gum disease known as periodontal disease. It doesn't even end here. It even gets worse as we get older. For adults over 65 years old, the rate of gum disease climbs to over 75%. So statistically, if you're watching this video, there's a real chance your gums are in a state of chronic infection right now that you may not even be aware of, because gum disease is usually painless and a silent infectious disease. Here's what happened inside an inflamed gum pocket. The gum tissue ulcerates, it develops tiny open sores. Several studies, such as the one published in Nature Reviews Immunology, describes the total surface area of these gum ulceration across the mouth with periodontitis is roughly the size of the palm of your hand. Now imagine holding an open wound as large as your palm with active, infectious, harmful bacteria producing toxins 24 hours a day into your bloodstream. From these ulcerations, bacteria reach every other organs in your body, like your heart, your brain, your joints, your vital abdominal organs, and your glands. Just remember, your mouth is not a closed system. It's directly wired to the entire body. Now let's get specific, because this is where it gets important. There are certain bacteria in your mouth that are far more destructive and harmful than others. Researchers call these bacteria keystone pathogen, meaning that even in a small amount, they can orchestrate massive immune disruption. I wanted to introduce you two of the most important ones, because the chances are, if you have autoimmune conditions, you have been already exposed to at least one of them. Number one, P. gingivalis. Number two, the red complex bacteria. How do these bacteria hijack your immune system and cause you autoimmune diseases? P. gingivalis is the most harmful oral bacteria in the context of autoimmune disease. P. gingivalis is an anaerobic bacterium, meaning it thrives in a low oxygen environment of your deep pocket in your gum. What makes this bacteria uniquely dangerous is an enzyme they produce called peptidyl arginine deaminase, or PAD. Here's what the PAD enzyme produced by this bacteria does. It takes normal proteins in your body and chemically alters their structures, function, gene regulation, and immunity by converting the amino acid arginine within these proteins into the citrulline through a process called citrullination. Now here's the problem. Your immune system has never encountered these modified citrullinated version of your own protein. So it treats them as a foreign invader and launches an attack by increasing productions of anti-citrullinated protein antibody, or ACPAs, which are the primary diagnostic markers of rheumatoid arthritis. The fact is that when your rheumatologists run blood tests and see elevated ACPAs, they are often looking at the evidence of an immune response that may have started in your mouth by these harmful oral bacteria. Moreover, DNA from these oral bacteria have been detected directly in the joints of patients with rheumatoid arthritis. These bacteria didn't stay in the mouth, they traveled. These harmful oral bacteria also produce a toxin called leukotoxin A, which attacks and destroys your neutrophils, part of your white blood cells on front line of immune system. When a neutrophil is killed by these toxins, it undergoes chaotic death, releasing a flood of citrullinated protein into your surrounding tissue. Scientists call this hypercitrullination. Research published in Science Translational Medicine showed a direct mechanism linked between hypercitrullination and initiations of rheumatoid arthritis. The red complex bacteria work with P. gingivalis to accelerate gum tissue destruction. They produce a toxin that essentially dissolves the scaffolding that holds your soft tissue together, enabling other bacteria to invade to your bloodstream. Let's look at how science links these oral bacteria and their toxin to various autoimmune diseases. For example, for rheumatoid arthritis, a landmark 2016 study in Science Translational Medicine established a direct causal link between the oral pathogen and elevations of a marker of ACPs in rheumatoid arthritis. Multiple studies have found DNA from oral bacteria, P. gingivalis, in joints of patients with rheumatoid arthritis. Multiple studies have shown that non-surgical periodontal treatment, deep cleaning, decreases rheumatoid arthritis symptoms. You treat the mouth and joint inflammation goes down. This is the direct interventional proof. For systemic lupus, research published in Journal of Clinical Medicine examined over 800 individuals and found that antibody to oral bacteria, especially P. gingivalis, were significantly elevated in lupus patients. These patients showed immunological evidence that their bodies have been fighting oral bacteria. For Hashimoto's disease, a 2024 scoping review published in BMC Oral Health found a high prevalence of periodontitis or gum disease among patients with all forms of thyroid disease, including Hashimoto's. For Sjögren's disease, the immune system attacks salivary glands, tear glands, and sweat glands. Data show a direct link between the red complex of oral bacteria and Sjögren's symptoms. Patients with Sjögren's are also frequently found to have significantly higher rate of gum disease, and their salivary antimicrobial function is compromised, creating a vicious cycle in which dry mouth enables greater pathogen growth, which drives more autoimmunity. So what do we do about this? This is where holistic and biological dentistry diverge significantly from conventional dentistry. A conventional dentist looks at your teeth and gum for a structural problem. A biological dentist like me views your oral cavity as a biological ecosystem in constant communication with your entire body. My approach at Arya Dental begins with something most dental offices don't do: a comprehensive evaluations of your oral microbiome. We use advanced salivary diagnostic to identify which specific pathogens are present in your mouth, including P. gingivalis and red complex bacteria I described earlier. We also use ozone therapy. Medical-grade ozone gas and ozonated water delivers directly into your periodontal pocket to eliminate anaerobic pathogens such as P. gingivalis without antibiotic side effect. These bacteria cannot survive in oxygen-rich environment, and ozone creates exactly that. It is the most powerful and targeted biological tools we have. We also use laser therapy. We use different precise high-energy light beam from diode laser, periolase, Nd:YAG, and CO2 laser to selectively target harmful bacteria and pathogens. We also offer LANAP, laser-assisted new attachment procedure, a precision laser treatment that significantly targets and destroys periodontal pathogens and diseased tissue while leaving healthy tissue completely intact. LANAP simultaneously stimulates the regeneration of bone and connective tissue that have been destroyed by chronic infection. This is a cut-free, stitch-free, painless procedure. It is minimally invasive, promotes real healing, and our patients recover quickly. We also offer biocompatible, toxin-free periodontal maintenance. We do not use fluoride-based or antibiotic-containing rinse in our protocol because we believe disrupting the entire oral microbiome creates secondary immune consequences. Instead, we use probiotic, botanical, and ozone-infused irrigation to rebuild healthy, diverse microbial balance. Here's what I want you to take away from this video. Your immune system is not attacking your body randomly. There's almost always a reason, a trigger, something that broke the tolerance and started the cascades of inflammation. For most autoimmune patients, the trigger is living inside of the patient's mouth right now. If you have an autoimmune condition and you haven't had a full biological dental evaluation, not just routine cleaning, but a real assessment of your oral microbiome and periodontal health, I want to be clear, you are missing a critical piece of your health puzzle. This doesn't mean the dentist replaces your rheumatologist or your immunologist. It means that true healing must be a whole body, and that starts with environment closest to your bloodstream, your mouth. Here are 3 specific actions I recommend you to take after watching this video. First, book a holistic dental evaluation. Call our office at Arya Dental in Mission Viejo at 949-364-9600 or go to aryadentalcare.com to schedule a comprehensive biological dental consultation. We will look at your oral microbiome, your gum health, and your existing dental work through the lens of your immune and systemic health. Then, ask your medical team the right questions. The next time you see your rheumatologist, your internist, or your integrative medical doctor, ask them, has anyone evaluated whether my periodontal health could be contributing to my immune system, autoimmune markers? If they don't know the answer, bring them this video. Science is there. It's peer-reviewed. It's among the top journals in the world. Final, share this video. If you know someone living with rheumatoid arthritis, lupus, Hashimoto's, Sjögren's, or any other autoimmune condition, please share this video with them. You may be giving them a piece of information that changes their life. I'm Dr. Maryam Horiyat from Arya Dental Care in Mission Viejo. If you found this video valuable, and I hope you did, please subscribe to this channel because this is the kind of education I'm committed to bring you every week. We're connecting the dots between oral health and whole body health because your mouth is not separate from your body. It has never been. And understanding that connection, truly understanding it, is one of the most powerful things you can do for your health. I'll see you in the next video. Be well, take care of your mouth, take care of your oral health, and take care of your whole self.